Paramedicine is a critical profession that provides emergency healthcare in the community. It has evolved from basic emergency response to delivering complex medical care in a variety of settings. Paramedics play a vital role in modern healthcare systems around the world. The image shows a dedicated team of paramedics responding to an emergency, highlighting the professional, high-stakes nature of their work. Paramedicine is a specialized health profession that operates across a variety of care settings. It was formally defined through an international consensus process in December 2021. Paramedicine combines elements of emergency medicine, primary care, and public health. Paramedics provide advanced life support to individuals who are sick or injured. This integrated approach allows them to deliver comprehensive care in both emergency and non-emergency situations. The slide outlines the evolution of paramedicine, from its origins in military medicine and early ambulance services to its current status as a recognized healthcare discipline. It highlights key milestones, including the initial focus on rapid transportation rather than treatment, the expansion of the scope of practice over the past several decades, and the growing professional recognition of paramedicine globally. The visual timeline with icons and brief descriptions helps the audience understand the key developments in this field. I would encourage the speaker to use this slide to provide a high-level overview of the history and progression of paramedicine, setting the stage for a more detailed discussion of the current state and future directions of the profession. Paramedics and EMTs are both emergency medical providers, but they have different levels of training and capabilities. Paramedics have advanced life support skills, with 2+ years of education. They can administer medications, perform advanced airway management, start IVs, and provide other critical interventions. EMTs have basic life support training, typically 3-6 months. They have more limited skills, focused on stabilization and transport. Their medication administration and airway management abilities are more basic. The key differences are the depth of education and the scope of practice. Paramedics can provide more advanced, on-scene care, while EMTs focus on rapid stabilization and getting patients to the hospital. Understanding these distinctions is important when deciding which level of provider is needed for a given emergency situation. The key areas of paramedic scope of practice are emergency response, advanced life support, patient assessment, critical transport, primary care, and public health. In emergency response, paramedics provide immediate stabilization and critical interventions to sustain life in crisis situations. Paramedics deliver advanced life support through critical interventions to sustain life, such as advanced airway management, cardiac monitoring, and medication administration. In patient assessment, paramedics perform complex diagnosis and decision-making in field settings to determine the appropriate course of action. During critical transport, paramedics maintain a high level of care for patients while moving them between healthcare facilities. In some settings, paramedics also provide primary care, managing ongoing health issues and promoting wellness in the community. Paramedics also play a role in public health initiatives, focusing on prevention and community wellness programs. Emergency medical technicians, EMTs, play a crucial role in the emergency response system. They are responsible for answering 911 calls and dispatching the appropriate resources to the scene. Once on site, EMTs must quickly assess the situation and triage patients based on the severity of their injuries or medical conditions. They then provide advanced resuscitation techniques like CPR and defibrillation to stabilize critical patients. EMTs also control bleeding, immobilize injuries, and prepare patients for transport to the hospital. In some cases, EMTs may even need to assist with unexpected emergency childbirths that occur outside of a hospital setting. Throughout the response, EMTs must remain calm, focused, and ready to perform life-saving interventions at a moment's notice. This slide provides an overview of some of the key clinical skills and procedures that our team is trained in. First, we have advanced airway management, which covers intubation, surgical airways, and ventilation support. This is critical for ensuring patients can breathe effectively. Next, we have cardiac care, including ECG interpretation, defibrillation, and administration of cardiac medications. Rapid diagnosis and treatment of cardiac issues is essential. Finally, we cover vascular access, including IV and intraosseous access. This allows us to deliver fluids and medications directly into the bloodstream when needed. All of these skills require extensive training and practice to perform safely and effectively in emergency situations. Our team is highly skilled in these areas. Paramedics work in a wide variety of environments, from traditional ambulances to more specialized settings like helicopters, hospitals, remote wilderness areas, and even alongside law enforcement in tactical situations. The images on this slide showcase some of the diverse work environments paramedics may encounter, from the high-tech equipment inside a modern ambulance, to the critical care provided in an emergency helicopter, to the fast-paced hospital to the remote and rugged wilderness, to the specialized gear needed for tactical operations. Regardless of the setting, paramedics must be highly skilled and adaptable to provide excellent emergency medical care in any situation. The key point is that paramedics need to be prepared to work effectively in a wide range of environments, each with their own unique challenges and requirements. The classic 911 model focuses on emergency stabilization and transport, getting patients to the hospital quickly when they have a medical emergency. Community paramedicine expands the role of paramedics to address healthcare gaps. They provide home visits and preventive care to help keep people healthy and out of the hospital. Industrial paramedicine involves specialized care for workers in high-risk environments like oil rigs, mines, and factories. Paramedics work on-site to provide immediate treatment and coordinate care. Tactical paramedicine integrates paramedics with law enforcement for high-risk situations. They provide critical medical support during things like active shooter incidents or hostage situations. Community paramedicine is a model of care that aims to improve patient outcomes and access to health care, especially in rural and underserved areas. It focuses on 4 key areas: improved patient outcomes and quality of life, reduced hospital readmissions and return visits to the emergency department, expanded access to care for vulnerable and underserved populations, home-based interventions like medication compliance, health monitoring, and patient education. The goal is to address gaps in the healthcare system and provide more comprehensive, community-based care. EMT Basic is the entry-level certification, requiring 120,150 hours of training. Advanced EMT is an intermediate level with 300,400 hours of education. Paramedic is the highest level, with over 1,200 hours of combined classroom, clinical, and field training. Degree programs are also available, including associate or bachelor's degrees in paramedicine or EMS. Around-the-clock shifts can take a toll on work-life balance for paramedics. They must be prepared to respond to emergencies at any hour. The physical demands of the job, like lifting heavy patients and working in difficult environments, can be very taxing on the body. Paramedics face significant emotional stress from exposure to traumatic situations and high-pressure decision-making. Regulatory standards for paramedic practice can vary widely across different jurisdictions, creating challenges in maintaining consistent care. Budget constraints can limit the resources available to paramedic services, affecting equipment, staffing, and the ability to provide optimal care. The future of paramedicine is an exciting and rapidly evolving field, driven by key trends like academic integration, technological advancement, and specialized practice. We're seeing an increasing focus on research and university-level education programs for paramedics, which is helping to build a stronger evidence base for best practices in pre-hospital care. Paramedicine is also becoming more integrated with telemedicine and digital health solutions, leveraging portable diagnostics and AI-assisted decision support tools to enhance patient care. Additionally, new subspecialties are emerging, like critical care paramedicine, which are creating enhanced career pathways and professional development opportunities for paramedics. These advancements are transforming the role of the paramedic, equipping them with cutting-edge tools and knowledge to provide even more specialized and effective pre-hospital care. Paramedicine is an essential healthcare discipline that combines clinical expertise with public health approaches. Paramedics are available 24/7 to respond to emergencies, always ready to provide care. There is a growing professional community of over 250,000 paramedics nationwide. Paramedics perform a wide range of advanced procedures and interventions in the field, up to 75 different types. Paramedics practice in diverse settings across the healthcare system, from ambulances to hospitals and beyond. Paramedicine continues to evolve as a vital part of the healthcare system, playing a crucial role in emergency response and community health.